Parents, I want to give you a heads up. Our next segment may not be suitable for children. Medical experts estimate it's a condition affecting about 5% of men at 40 years old, then increasing to 15% of men at age 70. Coastside Clinic offers surgery-free, drug-free, and non-invasive treatments to help patients who deal with ED. Andrew Reinert is a medical technician who joins us now to talk about Coastside Clinic's use of the True Pulse protocol. Hi, Andrew.
Hello, how you doing?
We're doing really well. Thanks for joining us today. Talk about what the recent studies are saying about men who deal with this condition.
Well, if you're out there struggling with erectile dysfunction, a clinical study was released, and it was something we kind of already knew. Depression and anxiety and stress are higher in men with ED. So we know this has a huge ripple effect on a man's sense of self-worth.
So when you talk about self-worth, obviously it's going to affect their self-esteem. When is it time for them to start seeking some help?
I think as soon as you see a failure in the bedroom, it is time. This is kind of like our hearing or our eyesight. It doesn't get better on its own. You have to do something, and it's so much easier to treat and fix early on.
And when you think about this condition, typically there's one type of treatment that people think is the go-to. Is that correct?
Well, it has been the go-to for 30 years. Men struggling with ED take the pill, but no longer. We have a breakthrough. Coastside Clinic uses the most advanced form of acoustic wave therapy. This is an FDA-registered device backed by science, showing it can gently open up and regrow blood vessels. That's what you need more of if you're struggling with erectile dysfunction. You will be amazed what can happen in the bedroom when we get your blood flowing properly.
Andrew, you mentioned science. What exactly is the science saying?
Significant data is out there. If you go to the science page at coastsideclinic.com, you can read 40 clinical studies testing our technology on men with erectile dysfunction. Even Cambridge University has tested this. The science is so strong. I think someday the pill may be a thing of the past. This is treating the root cause, and it really is a breakthrough.
Okay, so the science is one thing. What about the patients that you've worked with, that you've treated? What kind of feedback are you getting?
Well, we've treated thousands of men all over the country of every age with every kind of health condition. That could be diabetes or prostate issues. Now, it generally starts with skepticism and a little bit embarrassment. Once they get over that, though, they always come to us and say, I'm so glad I don't have to take the pill. I'm 50 years old, but I'm functioning like I was in my 30s. So this is the type of thing we hear all the time.
All right, Andrew, so if we have a viewer out there that wants to try this out, maybe they feel like it can help them with what they're dealing with, what kind of special offer do you have?
Well, only 30% of men with erectile dysfunction seek treatment. So 70% continue to suffer. Don't be one of those. Call us now. We have so much for free today. We will do the assessment, the exam, even the blood flow ultrasound at no charge. We'll throw in a little gift. You'll love this. It produces immediate results in the bedroom. Now, this is $500, but it's totally free to those that call now.
All right, Andrew, good stuff there. Thanks for joining us today. And if you want more information, just visit coastsideclinic.com.
This interview involves commercial content. The products and services featured appear as paid advertising.